Every year, cholera kills 100,000 people globally, with over 70% of them in Africa. In 2021 alone, an outbreak of the disease in Nigeria has affected 15 states and the nation's capital, Abuja. Last week, the Federal Capital Territory recorded over 500 suspected cases. Cholera can be attributed to lack of access to clean water and poor hygiene.
It's a seasonal disease. And at this point, it is a time that such disease may occur and arise. Reason is that cholera or gastroenteritis comes as a result of taking food or water that is contaminated with other so many things like fecal matters. Earlier, in a village where it's not choked up, there must be a specific place where they dump their refuse. In the houses, you check where they have toilet and bathroom. But you look at such facilities that I've told you are not available.
The very first case of cholera in Nigeria can be traced back to the 1970s. But since then, cholera has remained endemic in the country with reported cases almost every other year, particularly during the rainy season. This year alone, over 14,000 cases of cholera have been recorded in the country, with over 300 fatalities. And for health facilities like this one, there's that message of prevention instead of treatment of cholera. Cholera is an acute watery diarrhea disease that is caused by ingestion of contaminated food or water. Basic hygiene knowledge, especially in rural areas like this community in Jiwa, a suburb of Abuja, where clean water is scarce, can go a long way in reducing infections and even fatalities.
We treat them, and when they are coming for immunization, we give them a talk how to prevent themselves against cholera. They should be washing their hands before eating and after eating. Then we advise them how to treat their drinkable water.
The outbreak of cholera in Nigeria is usually heightened during the rainy season. These nursing mothers explain how they protect their families against cholera, which is currently affecting localities like Dede, Jiwa, Zuba, Kubwa and Wasa, internally displaced persons camps within the FCT.
You make sure you have a clean environment, because the issue of this outbreak is not, it doesn't work in a clean place. Cholera outbreak, we can contact it from anywhere, like this hour we are. We can contact it from anywhere. If the environment is not clean, we can contact it there, make your environment clean and neat.
Although primary healthcare facilities can be found in all 774 local government areas across Nigeria, having qualified medical personnel and basic hospital amenities remain a major challenge, especially during a cholera outbreak.
If you come in the night, they will not meet anybody here, because we are not here in the night. We are running morning and evening because of light, and due to the condition of the Nigeria now, so you cannot come here without light and stay here.
The only help we need is to send the drugs to all the nearby primary health care health posts, in order to see that immediate, if there's immediate, so that they will do it immediate. But you know, in this type of case, if the primary health care outpost cannot do it, they quickly refer to the tertiary institutions, health institutions. And you see now, at times, the problem we are having is that, like here, the primary health care, if it want to refer, it has to go to Gwarimpa. And Gwarimpa is very far.
Abuja city authorities say they have intensified cholera surveillance in the affected communities and health facilities, while embarking on public health education on the use of clean water, good sanitation, as well as personal hygiene to defeat the disease.
Because I heard that there is an outbreak of cholera, and they say it's from it's being contacted from bad water. So my husband asked me to be boiling the water, and after boiling it, I will keep it, it will cool, and I will be giving the children.
Washing my utensils, cleaning the house, making sure that everything is intact and neat. This cholera is disease outbreak, so by taking precaution, I always boil my water.
And although the Earth's surface is covered by 71% of water, over 60% of the Earth's inhabitants still lack access to clean drinking water. And as open defecation remains a major health issue in Nigeria, experts say it is important to adopt a multi-sectorial approach for the prevention and control of cholera.